This student actually recognized the diagnosis. The question is whether they followed the reasoning all the way to the medication. Let's walk through it. We have a 27-year-old woman with irregular menstrual cycles, obesity, acne, hirsutism, weight gain, and enlarged ovaries containing multiple small peripheral follicles. Before we even look at the answer choices, this should immediately suggest polycystic ovary syndrome. And that's where many students stop. They see PCOS and think, great, I know the diagnosis. But this question isn't testing whether you can diagnose PCOS. It's testing whether you know the first line treatment and the mechanism related adverse effects that come with it. The STEM tells us she is started on the most appropriate first line pharmacologic therapy. Then, 2 months later, her cycles are regular, but she develops breast tenderness and nausea. That treatment response is the pivot clue. For a woman with PCOS who is not trying to conceive, first line pharmacologic therapy is a combined oral contraceptive. Combined oral contraceptives contain estrogen and progestin. They suppress gonadotropin secretion, reduce ovarian androgen production, regulate menstrual cycles, and protect against endometrial hyperplasia. Now let's look at the answer choices. The student picked osteoporosis, and this is where the review becomes interesting. Osteoporosis is not a ridiculous answer. Students often associate hormonal manipulation with bone loss because they remember conditions involving hypoestrogenism, such as menopause, prolonged GnRH agonist use, or aromatase inhibitor therapy. So, osteoporosis is a real complication of estrogen deficiency. The problem is that this patient is receiving estrogen, not losing it. The mechanism doesn't fit. Now let's work through the other choices. Hyperkalemia might make you think of spironolactone. Spironolactone is used in some women with PCOS for hirsutism and acne because it blocks androgen receptors, but it is not the first line therapy being described here. Hepatotoxicity may trigger associations with medications like methotrexate or other drugs with known liver toxicity profiles. Again, that mechanism doesn't match combined oral contraceptives. Galactorrhea is usually linked to hyperprolactinemia, prolactinomas, dopamine antagonists, or other causes of elevated prolactin signaling. Nothing in the stem points us in that direction. That leaves venous thromboembolism. And this is the answer that survives. Combined oral contraceptives increase hepatic production of clotting factors under the influence of estrogen. That shifts the coagulation system toward a prothrombotic state and increases the risk of deep venous thrombosis and pulmonary embolism. The breast tenderness and nausea that developed after treatment are actually additional clues that estrogen containing contraception is the medication being used. The reasoning pathway looks like this. First, recognize that the patient has PCOS. Once you've identified PCOS, the next question is, what's the first line treatment for someone who isn't trying to get pregnant? That's a combined oral contraceptive. The stem then gives us another clue. After starting treatment, her cycles become regular, but she develops breast tenderness and nausea. Those are classic estrogen related effects and help confirm we're dealing with an estrogen containing contraceptive. Once you've made that connection, the adverse effect you're supposed to know is the increased risk of venous thromboembolism. In other words, the diagnosis gets you to the treatment, and the treatment mechanism gets you to the answer. The student didn't miss PCOS. The student missed the treatment mechanism link. They correctly identified the disease but failed to follow the pathway from diagnosis to first line therapy to mechanism to adverse effect. That's why the correct answer isn't just venous thromboembolism. The correct answer is understanding the chain, PCOS to combined oral contraceptive to estrogen effect to thrombosis risk. And that's exactly the type of reasoning error MDSteps is designed to diagnose.